Hello, and welcome to today's panel discussion, Vaccine Hesitancy, the Politics of Public Health in Tennessee. I'm Daniel Diermeier, Chancellor of Vanderbilt University. Today's event is being hosted by the Vanderbilt Project on Unity and American Democracy, which is a nonpartisan initiative designed to bridge our national divisions and strengthen the pillars of our democracy. We believe that constructive conversation, guided by historical evidence and fact-based reasoning, can help reestablish the common values we share as Americans. And we further believe that higher education has a duty to set the stage for such civic discourse, leveraging the research and expertise of scholars and drawing diverse voices into meaningful conversations. The Vanderbilt Project on Unity and American Democracy seeks out viewpoints from across the political spectrum to help find genuine solutions to the challenges that affect us all. COVID-19 vaccine hesitancy is certainly one of these challenges. As America faces a growing surge of new infections caused by the Delta variant, hospitals and regions with low vaccination rates are buckling under the strain. Many of the problems stemming from the pandemic continue, from job losses to unequal gaps in education for our nation's children. This is happening even though the United States has universal access to safe and effective vaccines, some of which were developed right here at Vanderbilt University Medical Center. Decisions about personal and public health should be informed, above all, by experts in the field. And yet, this issue has become deeply politicized, pitting neighbor against neighbor in a debate rife with misinformation. This is why we have convened today's panel of Vanderbilt medical experts and concerned politicians. Today's conversation is designed to provide evidence-based information that we hope encourages those who remain hesitant to consider getting the vaccine. It will protect their own health as well as the health of the general population, particularly children under 12 years old and those who are medically vulnerable. Our discussion today will be moderated by Pamela Jeffries, Dean of the Vanderbilt School of Nursing. Dean Jeffries is an internationally recognized leader in nursing and healthcare education. Prior to joining Vanderbilt as Dean of the School of Nursing in July 2021, she served in a series of leadership roles at Johns Hopkins University and as Dean of the George Washington University School of Nursing. I will now turn it over to Dean Jeffries to begin the discussion.
Thank you, Chancellor Diermeier, for the warm and compelling welcome. And thank you, Vanderbilt Project Unity and American Democracy and Vanderbilt University Medical Center for hosting this important discussion. Today, we have gathered a dynamic panel of experts to elevate facts from the COVID-19 vaccine and to debunk some of the myths associated with COVID-19 vaccine hesitancy in Tennessee and across the broader U.S. I also look forward to the opportunity to discuss solutions for increasing vaccination rates as a community and a more unified nation. I'm Pam Jeffries, Dean of Vanderbilt University School of Nursing, and I am honored to introduce you to all of our panelists who share the common value that vaccination among our communities is necessary to save lives and to get our country back to a sense of normalcy. First, I would like to introduce Paul Mango, who served as the Trump administration from 2018 to 2021 as Deputy Chief of Staff of the U.S. Department of Health and Human Services, helping to manage Operation Warp Speed, a public-private partnership initiated by the United States government to facilitate and accelerate the development, manufacturing, and distribution of COVID-19 vaccines, therapeutics, and diagnostics. Also joining us is former U.S. Congressman Phil Rowe, a practicing physician of 31 years who most recently served in the House of Representatives on behalf of Tennessee's 1st District from 2009 to 2021. Dr. Rowe served as chairman of the House Committee on Veterans Affairs and was co-chair of the House GOP Doctors Caucus. He has a practice as an OB/GYN in Johnson City, Tennessee, delivering more than 5,000 babies, and launched his career in the United States Army Medical Corps during the Korean War. Finally, I'm glad to introduce Dr. Alex Jahangir, Executive Medical Director of the Center for Trauma, Burn, and Emergency General Surgery at Vanderbilt University Medical Center. He is also chair of the Metro Nashville Board of Health and the Metro Coronavirus Task Force. Frequently referred to as Nashville's Corona Czar, Dr. Jahangir has spoken to the media hundreds, if not thousands of times over the past year to advocate for science over politics and the urgent need for adults and children to get vaccinated. Thank you all so much for joining. And just on behalf of nursing, I speak for that as well as other health professions. But nursing, as you know, is the largest healthcare provider. We're 4 million in number. And as our role as a nurse, we're a very trusted source of information. We can also serve as role models by getting information on the vaccine, protecting ourselves, and helping our patients and the public to understand the benefits. So I couldn't be more thrilled to moderate this panel. So let's get started. Ready? So why? Let's go with the first question. Why is misinformation about COVID-19 deemed as an infodemic by the World Health Organization, posing an imminent threat to our nation's health? And what is causing this proliferation of such misinformation? Alex, let's start with you.
Sure. Thank you for allowing me to be part of this panel. You know, the issue of misinformation is really, I think, a broader issue in our society now, in that it's almost now expected that every issue becomes so divided and so and people have to fall into camps. And you now have a platform with social media, Facebook, Twitter, and so forth, that these messages travel quickly. I mean, I think probably back in the polio days, there probably was misinformation, but the news didn't spread so quickly, right? But now you can find people who quickly spread misinformation, can put it on social media, can be very savvy, and people go out looking for ideas that fulfill their own biases. And so I think our biggest problem is we have not taken enough time to think for ourselves sometimes, and we're letting people who may have ill intent have platforms that previously were not available to them.
Thank you for that. Any other thoughts on information, Paul or Phil?
Yeah, let me just add to Alex's comments. I think because we were in the middle of it, obviously, starting in January of 2020, and we saw this whole thing evolve. And I think sometimes the American people confuse new information with misinformation. And what I mean by that is what we knew in January and February of 2020 is radically different about this virus than what we know today. And I think the government has tried to communicate its new learning to the American people, but that new learning is often different than what existed prior. And I think sometimes people view that as, oh, did you switch your position? Did you not know what you were talking about before? And I think it's really just a function of learning more about the virus and trying to communicate it.
Mm-hmm. Thank you, Paul. And we certainly have learned a lot over these, past year and a half or so. I like the term new learning. Phil, anything to add?
Absolutely. One of the things I get asked all the time, Dr. O, how do I know what the truth is? How do I know who to believe? And I think that's a very important question for the American people. And we as policymakers don't answer that honestly with people and give them factual information, as Paul just said. And we've learned a lot more in the last 18 months. There's no question about that. But we can't pass that along as flip-flop, and we have to pass it along as we've learned about the virus. And one of the things that we also have to be is very humble about this, because we have learned, and what we thought we knew a year and a half ago turned out not to be correct. And I think we've got to be not arrogant. We've got to be very humble with people and honest with people and say, look, if you make a mistake, own up to it and just say, we got that wrong, and move on. There's nothing wrong with that. I've done that throughout a career. And I'm sure Alex has done exactly the same thing as a practicing physician there in Nashville.
Mm-hmm. Thank you, Phil. I mean, we've just lived in unprecedented times, and new information has evolved, as all of you have described. So thank you for that. So let's go to the next question. Helping speed the development of the coronavirus vaccine may be one of President Trump's proudest accomplishments. But as research from the Vanderbilt Poll and Pew Research Center attest, a substantial number of Trump supporters resist vaccination. What can be done to overcome this hesitancy? Paul, we'll start with you on that.
Yeah, let me start by talking about some of the extraordinary measures we took to ensure these were safe and effective vaccines, much more than prior vaccines that have been approved by the FDA. So Peter Marks, who runs the center that approves the vaccines within the FDA, would say that on average in the past, we've had about 20,000 participants in clinical trials for phase 3 clinical trials, which is the final phase to seek approval. The FDA last summer set a minimum for these COVID vaccines of 30,000, and indeed, Pfizer and Johnson went above 40,000. So these are quite extraordinary numbers. The second thing he did was there's evidence that suggests that any problem someone's going to have with a vaccine usually reveals itself within 42 days of the time you get vaccinated, and in this case, a second shot, let's say for Pfizer and Moderna. The FDA extended that time frame to 60 days. So in other words, Pfizer could not submit its application for an EUA, an emergency use authorization, until the median participant in its trial got its second shot, and then 60 days had to evolve beyond that. So something like 99% of all vaccine problems emerge or reveal themselves within 60 days. So extraordinarily safe procedures. Where we accelerated the time frame was really in what we call manufacturing at risk. We started manufacturing vaccines before any approval was given, and the commercial markets, the private markets, would never do that because it's too risky. That's where we saved a tremendous amount of time. So I think the American people should understand that these vaccines have gone through a more rigorous evaluation than a lot of the vaccines that they've taken as children or whatever over the years. I think it's hard to explain why there's some degree of hesitancy, but I will say this, and Dr. Rose on the panel here, I do believe this is a decision between a patient and his or her physician. That's how this decision should be made, not the federal government telling us what to do. I think it's a very personal decision, and I think there are instances, I think Dr. Rowe could probably comment on this, where persons maybe should not get the vaccine if they have certain prior history of reactions or whatever. But I think it's a decision between the individual and the doctor.
Mm-hmm. Well, thank you, Paul. And I love some of the background you're telling us, even going from the 42 days to 60 days, having the facts put in front of us is very helpful from my perspective, because I like to hear the statistics. I'll probably be more of a qualitative type person. So thank you for that and for your firsthand experience. Phil, anything to add?
I want to go back to January of 2020. When the World Health Organization told us as a nation that there was not human-to-human transfer of this virus. And to show you, and I want to walk you through how the vaccine, to add to what Paul had to say. So within 6 weeks of that, we had sequenced the virus and begun phase 1 trials. And he didn't go into depth on Operation Warp Speed. I don't think people understand the significance of what actually happened. What happened was, we wanted to provide the American people a safe and effective vaccine as rapidly as we could, because we thought that this could be a really devastating epidemic, now pandemic. And what they did was they add 4 platforms, 4 ways vaccines are produced. One is a new mRNA, which is the Moderna and Pfizer. 2, the adenovirus, Johnson & Johnson. Then you have an attenuated virus. That's what the Russians and the Chinese use. There are 4 platforms. They picked 2 companies in each platform. And to be able to qualify for that, you had to be able to produce the vaccine. It's one thing to produce 50 cc's. It's another to produce millions of doses. At exactly the same time, General Perna was charged with making sure that there were, and he was on operation part of the team, make sure that there were enough syringes, that the supply chain worked. You and I both know the biggest problem we had to begin the pandemic were PPEs. We couldn't get masks and gowns and gloves and all the other things we as nurses and doctors use. All that went on simultaneously. As soon as phase 1 trials, which are usually 45 or 50 people, finished, and no adverse reactions, phase 2 trials began. And I want to give a shout out to the American people. They stepped up by the tens of thousands to volunteer for these trials to find out if this vaccine would work to help protect their neighbors. And I can't say enough for the people who did that. I volunteered for the trial, and they didn't need enough people in my age group because I knew that over 65 years of age, 80% of the deaths occurred there. So it was imperative. We knew the nursing home tragedies that occurred early on. Phase 3 trials began about July or August, and by October, late October, November, we had an approved vaccine. The fastest vaccine that had ever been brought to market in the past was mumps. That took 4 years. Typical vaccine is 8 years. Can you imagine the devastation in this country and the world if we'd waited 8 years for a vaccine? So, and the shots were being given, I think the approval was the 10th or 11th of December. Shots went out then, and we began to vaccinate folks. And what we have to convince people is that it is a safe and effective vaccine. And the 19th of December, to show my support, I got my first shot. I said, I want to be sure. And the doctor's caucus, every single one of us, matter of fact, one of the members was actually in the trial, but we all volunteered to take the vaccine because we believe it's safe and effective. I know it is.
Well, thank you, Phil, and kudos, as you said, to the American people who participated in the trial to help to get us through the warp speed. And thank you also for covering the significant events leading up to this. So, Alex, in your role, I'm sure you have other comments to add?
Yeah, I mean, I think Operation Warp Speed, I go to Phil and Paul, thank you for your leadership in that. Remarkable, right? I mean, look what can be done in our country when a lot of really smart people and dedicated people commit all the efforts, the financial resources, taking away some of the regulations that not regulatory process as far as safety, but just kind of moving things along. And look what can happen. And I think what is so amazing for me is that it was done so quickly. But what is equally as amazing for me now on this end of it is when you explain that story to people and you explain it even more just simply than the amazing stories that just were told, people get it. Any hesitancy that I've had from people because they felt that the vaccine was made too quickly goes away when people understand that story. And I think what is critical on the local level is that you find individuals, so nurses, doctors, pastors, community leaders, to relay that message. And the way you do that is you have to provide that information to these local community leaders so that they can also have these talking points. And they know that, this was not sped up in an unsafe manner. In fact, it was probably slowed down, as Paul just noted, to make sure it was excessively safe. And I think my experience has been, and what I hope that others will continue to do, is share that story of how this is really a remarkable advance in U.S. history and world history because of some of the decisions made during that time frame. And hopefully when the right people have that information, and the right people, frankly, are not me as a talking head on TV, but really the people at the local level, the healthcare providers, the community people, that's how we're going to get past this hesitancy. And this story is one that I think we need to continue sharing for generations to come.
Thank you, Alex. And I couldn't agree more about the key community leaders. That's who the community trusts, right? But getting those key messages and talking about this journey of the vaccination and getting the facts out there is so crucial. So thanks for your input on that. So let's move to another question. Phil, I'm going to start with you. Is the infodemic fueled by partisan politics, or is there something bigger at play here?
No, I think it is fueled by politics. And unfortunately, the pandemic had to occur during an election year. So you could see that happening, and it still is, unfortunately. And after almost 40 years of practice in medicine, I've never operated on a Republican or a Democrat cancer in my life, but I've operated on plenty of them. So it affects all of us, regardless of party affiliation. This virus is a nonpartisan infector of everybody. And so you have to keep that in mind. And I think one of the things, that we need to talk about, it's extremely important, is the trust of the American people and the press, because they don't. And I'll give you an example. Dr. Fauci this weekend's on TV, and he opines about the Sturgis motorcycle rally, which was outside. And assuming that many of those motorcycle riders are probably conservatives or Republicans. But he failed to mention Lollapalooza in Chicago, which had 100,000 people there. At that, he failed to mention President Obama's party inside, and he failed to mention the 210,000 people in July who came into this country illegally. I'm going to travel internationally in a very short time. And let me explain to you what I have to do to travel internationally. I have to have a passport, obviously, to prove who I say I am. Number two, before I travel, 3 days before, 72 hours, I have to have a negative PCR test. When I get to the country of origin at the airport, I get another PCR test. I have to prove I've been vaccinated. And then when I get to the hotel, I have to have a blood drawn and show I have antibodies, all while masked up, I might add, before I can go into the country. So people see that hypocrisy where we have all these folks come in, being released into the country with COVID, and they're expected to mask up and do as they're told. That is a problem. And it's one of the problems that we're running into right this minute. And I hope that's what this symposium is about, is to say, look, at the end of the day, that's something you have no control over. You've got to control what's best for you and your family. And my job as your doctor would be to sit down and say, you're 68 years old, you have type 2 diabetes, and 10%, or at least 80% of all the deaths occur in this age category. And so I would recommend you have that. And I would recommend you do that. And they would say, well, Dr. O, have you done that? Yes, I have. Has your family done it? Yes, they have. So I think those are the kinds of things we as physicians, and I do believe we need to get the shots down to the level of the practicing physician. And also, I might add that the most trusted group of people in the country are nurses. So nurses could absolutely play a huge role in vaccine hesitancy, I think. They're very trusted.
Couldn't agree with you more, Phil. We've been a most trusted profession for over 20 some years, and nurses do play an important part and will continue. But I loved your physician lens too. You talked about the personal messages be very important, and it is for each of our patient, our families in the community. Those personal messages are so crucial. And I love the notion about a nonpartisan virus. Isn't that the truth? So, Alex, anything to add to that about the infodemic?
It is interesting. I just last week received a phone call from a friend in Virginia, somebody I hadn't even spoken to in years, who's a healthcare executive, right? So this person was a former military person, I believe was a police officer, and entered healthcare industry and went up the ranks as an executive. And I believe politically he's probably more conservative. I don't know that with certainty, again, because like most of us, our friends are our friends, and their political opinions are, part of what makes us their friends one way or the other, right? And, some of my closest friends completely disagree with me politically on everything, but that's how the world should be. But here's what was interesting about his call. He called me because he had not been vaccinated yet, and he was really contemplating it. But he realized he didn't have I hate to use the word safe place, but he didn't have a safe place to have a conversation with somebody about the vaccine. He knew that if he spoke to half his friends, they would ostracize him for not having had the vaccine yet. They would ostracize him for, the names and the humiliation that it may cause with a certain group of his friends who all probably, frankly, politically thought more like I did. Then on the same token, he expressed to me he couldn't speak to another set of his friends who probably thought differently than I do. I probably think more on the conservative side, because he didn't want them to ostracize. He didn't want to be ostracized by them for contemplating to get the vaccine. This is a very smart individual who is a successful executive in a large healthcare company. And he is having problems finding someone to have a conversation with. And the partisan lens that people have placed on this has fundamentally killed people. And it's killed people because we're not being civil with each other. We're not being compassionate with each other. We're not allowing, again, people who may have legitimate concerns about the vaccine. And this gentleman's original hesitation came because of some vaccines he received when he was in the military, had some reaction. And he doesn't have a regular, healthcare provider. I mean, that's the other component of it. I mean, he's, 30-something-year-old person. He feels like he didn't need one. So the fact that he felt ostracized to get good information because of how politicized this has become. Really was a wake-up call to me, even now, 18 months into this. And I think we just need to tone it down. The way we tone it down is you have leaders at all levels of government and the community to just make it okay to have some hesitancies, but make it okay to also ask questions. And that's what I hope we can do as a community moving forward.
It's a great point, Alex. And I'm so glad that you created that safe place for him to have that conversation. But I think you bring up you raise a more of an awareness type advocacy question is where are the safe places that people can go because of the political realm that the vaccines have become. So thank you for that, sharing that information. Paul, do you have something to contribute?
Yeah, well, let me just start by saying I've probably, been on 15 or 20 news hits since January. And every time I have the opportunity, I congratulate the Biden administration for the extraordinary job they've done on rolling out the vaccines, and they have. And I comment that no one is happier about that than the folks in the Trump administration who actually developed these vaccines. But I'm a little bit surprised that they're surprised by the hesitancy when you had candidate Biden and candidate Harris both saying they would never trust a Trump vaccine. And then on January 20th, when they took over the operation, they could only say that we left them a mess, that we didn't have a plan, and that they had to start from scratch. I just have to say that doesn't enhance the vaccine willingness when people say those types of things. So I think we should just stack hands. And I've said I think President Biden should invite former President Trump to the White House and have an event where they can both say, listen, this is an American issue. Let's put politics aside and let's get everyone vaccinated. So haven't seen that yet, but maybe someone from the administration will watch this panel and have a different thought about it.
Mm-hmm. Well, thank you, Paul, for your comments. And unfortunately, it was an election year and politics did play somewhat. And according to the story that you're describing that we've all experienced. So let's talk a little bit about Tennessee. We are all aware Tennessee's adult and children vaccination rates are significantly lower than the national average. While state and national rates are improving, rural communities in Tennessee and across the country still fall behind. What are the arguments and the sentiment at the federal level and state level that are influencing our rural communities' decisions to vaccinate? Alex, can we start with you this time?
Yeah, what I think about vaccination rates at a local level, literally daily, if not maybe hourly. I have to first say I'm proud of Nashville. Right, Nashville has about 55% vaccination rate for one dose for everyone, including kids who aren't even able to be vaccinated yet. 49% fully vaccinated, which is in line with the national average. So I think first I would say that the sentiment that all of the Southeast isn't doing its part is I would like to push back a little. But with that said, we still have communities in Tennessee, and it really saddens me right now that are dismal in their rate. Right, the state average is about 10 points less than Nashville's average, and if you think about if Nashville has raised it this much, that means there's communities that are way below even that 39% vaccination rate, and part of that, or a lot of that, comes around to this conversation we've been having is these communities, these individuals, and the congressman probably knows this better than even I do, they rely on local leaders to help them with certain decisions or to make them aware of certain decisions and certain options. And rather we have not done as good of a job as a state, frankly, getting into these smaller neighborhoods and smaller communities. In Nashville, we had the same problem with certain populations within the city. So our new Americans mainly live in the southeast part of our city. We didn't do a good job initially reaching this group because, again, we as a city figured our broad messaging would get to everyone. Well, it didn't. But once we partnered up with community organizations and faith-based organizations and started doing vaccine events, we have had success. We've done 375 pop-up vaccine events in Nashville alone. That has raised our numbers up. I think as a state, we need to do more pop-up events in the local communities by people who these communities trust. And I have not seen that outreach occurring yet, because in the state of Tennessee, for those who are watching who may not be from here, the 6 major metros have their independent health department. The 89 other counties, their health departments are under jurisdiction operationally of the state. And so, frankly, I think we need to do a better job getting into those communities, and not say, oh man, we only vaccinated 7 people at this event. Why did we do it? Rather be happy that we vaccinated 7 people, and we should do more of those. And that's the mentality we've taken as a city. That's why when anyone asks us to do a pop-up event, we'll make it happen, even if it means 3 people are vaccinated in 4 hours.
Mm-hmm. Thank you. Community input, community involvement, once again, and I love the partnerships with organizations seem to be key to success. Paul, anything to add?
Yeah, no, I just, I'm not sure I know what a good solution is, but I do believe, there's a lot of folks in rural communities who have just a fundamentally different view about the role of government in their lives. A lot of them are in agriculture, they're farmers and that type of thing. They face hazards every day. Farming is one of the most hazardous professions in our country. They have to deal with weather and all types of other things. And I think they are a little bit more of, at least have this perspective of rugged individuals. And it's just a different view again of what the role of the government is in their lives. So I don't think we should criticize them at all. It's just their point of view. I do agree with Alex that, the more opportunity we have to introduce the vaccines through institutions and through events that they're familiar with, that they feel comfortable with, I think we'll have a lot more success. But I would hesitate just to impose the way we do things in cities on the way they receive or accept things out in the rural communities.
Mm-hmm. Thank you, Paul. I think having the attitude of no blame, not criticism, that's so important for each individual. Thank you. And Phil, anything to add?
Well, I agree with both of them, and there are different approaches for urban areas versus rural areas where I live, and you have to get to the folks who the people trust and talk to them one-on-one. And there's a healthy distrust of government out here. There really is now. And the messaging that's come from government has been convoluted, to say the least. I would hesitate to call it a dumpster fire, because I'm afraid I would basically insult a dumpster fire. It's been that bad. And when you get, and I know this in the practice of medicine, and Alex certainly knows this, if you have 4 partners and all 4 of you telling the patient something different, you're going to have a very confused patient. And that's what we have now in the country, is a very confused patient. And that's one of the things I think these symposiums that you all put on, and I want to thank, it burdens my heart being a UT grad to thank Vanderbilt, but I thank you guys for putting this on to inform people and hopefully lower the temperature in the room and give folks the facts as we know them today.
Mm-hmm. Well, thank you, Phil. And being from a rural area in Indiana, that's where I come from, totally understand the messages and approaches that you're outlining. So thank you for that. So let's go to another question about the media. There's a lot of talk in the media about the role of the evangelical church and the religion's influence on vaccination rates in rural communities. From your experience, who or what organizations have the greatest influence in speaking to the rural communities?
Yeah, I think at the beginning of the pandemic, I realized that there was so much information, and for Alex and Paul and myself, who deep dived into this, a little easier for us, or you as a nurse, you have a science background, but if you don't, it's hard to understand this, and who do I believe? So what I did in my congressional district, I encouraged others to do this. I have a pastoral advisory committee. I've had that since I started in Congress. I started regular phone conference calls with them, because some of them were in huge churches with, a couple thousand members or 3,000 members. Others were small country churches, may have 50 or 100 members. But I called these men and women up, these pastors up, and I spent as much time as we needed. And we talked about this, what's going to happen. And this is before way before any vaccine. And they said, well, because they didn't want to hurt the people in their church. I mean, they're there to help lift them up, not to harm them. When do we stop? Do we wear masks? Do we do it virtually? Do we do it online? So we walked through every bit of that as we knew it at the time. And it seems to me that every one of them, once they had the information, passed it along to their congregations. And I think it was very helpful. I know I did that until I left in January when I retired from Congress.
Mm-hmm. Advisory committee from the pastoral group. What a wonderful idea. Thank you, Phil. Alex, anything to add?
No, I think what Phil had said in the last answer, I think echoes a lot with me. It is important for each community and the leaders in those communities to know who people listen to, right? And I think what works in DC or New York City won't work in Nashville, and works in Nashville may not work in Tullahoma. And I think having that recognition of that, and then having the ability to act accordingly, and what was just mentioned, a pastoral advisory group or a small business advisory group for rural areas, or those are the people who really can guide how best to deliver a message in a community. And so that local control, that local input is really important. And that'd be the one thing I would add further.
Yeah, thank you so much. And Paul, any other strategies or thoughts?
Yeah, I was a couple of years ago, I was a candidate for governor in the Commonwealth of Pennsylvania, and out in the rural communities, I got some great advice from a citizen who said, listen, if you're in this diner at 10 o'clock in the morning, everyone in the county will know you were there by 4 o'clock in the afternoon. And I think we can all think of diners in, kind of rural counties that fit that bill. But only half jokingly, there's a lot of communication that goes on in those venues. And I think if folks think about inserting the right information on vaccines into that venue, maybe the news will spread throughout the rural counties.
Mm-hmm. I love that. Yeah, news travels pretty quickly in those small communities, and being exactly. A small town gal, I can vouch for that. Also, not only, Phil, you mentioned the churches, but barbershops are a good area too to spread the information. And I know a lot of times in healthcare, we educate in barbershops. So there's another area. So from Sean Hannity to pop star Olivia Rodrigo, these are influencers coming out of shadows to more forcibly advocate for the vaccinations. Is it working? Who do you think has the power to influence or to instigate more vaccinations nationwide? Paul, let's start with you.
Yeah, I'll come back to what I said a little bit earlier. I think the best channel for that communication and influence is one's family or personal doctor. I think if we had to do it over again, if we went back to last September, October, when we were thinking through our own communication strategy, I think we would have used that physician channel, the American Medical Association, American Academy of Pediatricians. I think we would have really used that more effectively than we did. There's still an opportunity, but I think that's the best way, quite honestly, rather than someone on a news show talking about it.
Thank you, Paul. Phil, any thoughts?
No, I agree with Paul, absolutely. When a patient would come in to see me, and that physician-patient trust that you develop over a period of years, I can promise you is very strong. I have that with my physician right now. I listen to them about, should I have surgery? Should I have this or that? And so when a patient would come in, I would say, well, have you considered what's your family situation? Do you have anybody with pre-existing conditions in the family? Maybe you should consider that after we talked about the risks and benefits. And Alex will tell you that's time. It takes time to do that, but it's time well spent because you could save a life. And it's absolutely worth doing. I spent more time trying to talk people out of smoking cigarettes than I did doing a physical exam when I was in my medical practice. And I would tell them, I think I can help you more by doing that than I listen to your heart today. So I think those are the things we can do. We have that trust. And I think that's what we should do. I agree with Paul. It needs to be down the grassroots. I said this in the beginning as a Docs Caucus co-chair. I said, we need to make sure we get the vaccines in the doctor's offices. We need to get it down to not at the 30,000 foot level, but down where you and I go get our health care.
Mm-hmm. Thanks. Great advice, Phil. And Alex, any input from your angle?
The one thing I would add is we cannot have this conversation without recognizing the harm that is being conducted. I agree. First of all, local messaging is right, and healthcare providers is key. But let's not forget about the harm that's being done when there are national or influential people on TV, radio who talk about how vaccines are going to change your DNA, or how literally I heard someone say the vaccine's a sign of the beast a few days ago, and on an influential thing, because that messaging puts a lot of confusion and maybe doesn't even allow somebody to have that conversation with their healthcare provider, right? So I think there needs to be more pressure, in my opinion, placed in the dialogue on a much broader scale that, hey, let's not encourage any more of these my words, crazy talk anymore. Okay, because I think if you mitigate that messaging that's loud from sources that are not credible, then I think more people are inclined to go to the credible sources at the local level, the people they trust, to have the dialogue of, is this vaccine right or wrong for me? And I think that messaging is equally as critical than just local messaging.
Alex, if I could just say one thing. This morning, before we are doing this show, I'm on the phone for 15 minutes talking about a vaccine with someone in their family. And I know you've done it Alex, you've done it at dinner when you're out with friends, and we kind of bring, well, hey, Alex, what do you think about this vaccine? I mean, you've heard that over and over. Well, I went through in great detail about it, and they're going to go get their vaccine today.
Good. Well, that must make you feel good. I mean, one person at a time, right? If that's what it takes. So, Alex, back to you. But in your opinion, what has to happen to increase our numbers here in Tennessee or in the Nashville area? What do we have to do?
Well, we have to stay. We have to continue being resilient and persevere, and not get tired of having the same conversations. I mean, with Dr. Rowe, the conversation he had this morning, we need to continue doing that, right? I strongly believe, and I would assume the panelists agree, the talking heads on TV, we're not going to do it anymore, right? We reached the people we were going to reach, and that's great. But really, it's continuing to. And I'm not a political. I've never run for anything. I don't ever envision I will. But I guess the canvassing that you all have done when you run for office, getting people to trust why this is the right thing to do, making it easy, and then having that, knowing that what works in New York doesn't work in Nashville, it doesn't work in Tullahoma. Messaging is critical, but really just staying perseverant. We can't just throw our hands up in the air and say, I'm done. I don't know what to do anymore. That would be a failure, and it would be a disservice to all the work that's put to get us to this point, and all the lives we've lost to this point as well.
Mm-hmm. Thank you. I think key is to persevere, as you described. So, Phil, anything to add to that?
Yeah, I think one of the things and where information is helpful is that who gets this virus and who dies from it. Well, we know that 80% of the deaths are over 65. We do know that. And if you look at that population group, they've done I'm in that population group, have done a pretty good job of getting vaccinated. It's upward. Alex, you can probably give me better numbers, but it's between 80 and 90%. It's high. And when you look at school children, I looked at the CDC data for influenza A and B in 2017-18, I think it was, and it's virtually the same as it is for coronavirus. So and that's where the real controversy, do you wear a mask at school, or masks effective? Are you going to mask up kids again? There's a whole nother debate that's out there about how you handle this pandemic, because there are cause and effects when you do something. For instance, we had 93,000 people last year die of opioid overdose deaths. And who knows how much of that was because of isolation. Suicides were up in children, 10 to 18 years of age, up astronomically. So there are untoward effects to these, and I think you have to push the population that's going to fill up your hospitals. That was the whole idea. We don't want to overload our hospitals. And I might ask this question in nursing. I think one of the biggest problems we have in America today is our nursing shortage. We don't have enough nurses to take care of the sick patients that are in the hospital. I think I'm correct on that. And the next 10 years, it's only going to get worse. So we have all of that. And I think that's the hesitancy people have. Well, I'm healthy. I'm 35 years old, like Alex's friend. I don't really think I need this. Why would I take the risk? And I think those are the questions that we, as medical people, it was easy for me. I looked at the risks and the benefits, and by far, and with the knowledge I had, the benefits greatly outweighed the risk. And that's what you have to talk to other people about, and then let them make that decision. Yeah. And I will ask Paul this question, and this is about the mandatory part in the military.
Yeah.
You give up your constitutional rights when you go in the military, don't we? I know I did. So if they told me to get a shot, I'd get the shot.
Yeah.
I don't disagree with what General Austin is doing. I think the military is, I think I mentioned, I was in a unit that had to be prepared to deploy anywhere in the world in 48 hours. If you're not vaccinated, you're putting a whole bunch of folks at risk. It's a different situation. But Pam, let me just comment and build upon Phil's earlier comments. You know, Dr. Fauci very early in this pandemic came into one of our meetings and said, this is the most unusual virus I've ever encountered for two reasons. One, the tremendous amount of asymptomatic transmission, meaning you don't even know you're transmitting it to someone else. And two is the high degree of asymmetric clinical impact, which is what Phil was talking about. It kills some folks. Other people don't even get the sniffles, okay? When you put those two together, you have a situation where some are hugely at risk of contracting the virus and dying from it, and others, actually a majority, are not. And when you look at the facts, 99.8% of Americans have made it through the first 18 months of COVID, right? So it's not completely irrational that a young person who's relatively healthy says, why would I bother? And I think that's the essence of the challenge that we have. Yeah. This isn't Ebola or something that has a high rate, of fatality for anyone in any demographic. It's completely asymmetric and asymptomatic. And I think that's what makes it a huge challenge.
Yeah. Thank you, Paul. The ambiguity in these unprecedented times is just astounding. So in closing, I'm going to conclude for our audience today, for those who may be struggling with the vaccine, there's hesitancy, or they're dealing with a friend or family member that might be resistant. What are your recommendations for how we can effectively talk to each other about the vaccines, about the pandemic? And just brief strategy here, because we're about to conclude. Phil, I'll start with you.
Well, I have... I look at my own family personally. I've given them an advice. Some of my family members won't get vaccinated. I've explained it and that's perfectly okay. In a free society, they should be able to not do that as long as they understand the risks. And I know as a practicing physician for years, I would recommend a treatment to someone, but they may not want to do that. And that's their prerogative not to. I think our job, and I think when someone thinks that this may affect me and my family adversely, then they're more likely to get the vaccine. And look, vaccines have been, if you look around, I was a little kid during polio. It may have saved my life or saved the way I live the rest of my life and not being crippled. I'm very thankful that Jonas Salk did what he did. And I wasn't faced with polio because of what he did. And there are many people alive today who are going to be alive because of this vaccine that was developed by Operation Warp Speed. And I really thank those folks, Paul being one of them, was on the inside that got this done. So I think what we have to do is people who trust, is talk to them. I know, Pam, you talk to people every day about this and try to convince them that this is best for them and for the community. But it's got to ultimately be what's best for them. You can't say you're going to save California if you live in Nashville. What you're doing is making sure that you and your family are safe. So that's what I would recommend you do.
Thank you. Thank you, Phil. Alex, your brief input.
Everything that was just said, but I will say there's, if a lot of people do still use the internet, and there's some great reputable sites, getvaccineanswers.org would be one I'd recommend that really gives you good normalized information about vaccines. So really, in addition to the conversations, go to reputable sources to do your own research and make your decision for you and your family.
Thank you, Alex. And Paul, the last word.
Yeah, just a wise old person when I was younger told me once, you can make a lot more progress by posing questions than asserting positions. So I think, a dose of empathy and maybe just, drawing people out with questions. Do you know what the safety profile is of this vaccine? It's the most effective vaccines that have hit the market in decades? Do you know that, there were 40,000 persons in the clinical trials? Rather than asserting a position, you should get vaccinated. I think some well-placed questions might lead to more progress.
I like it. Well, thank you so much. So thank you for participating in this timely discussion. I know our audience appreciates these key takeaways as we fight to curb the spread of COVID-19 and keep our families and our communities safe. I also want to thank you to VUMC and our Vanderbilt University Project on Unity and American Democracy for hosting us. So please be safe and stay well. And thank you on behalf of all of us.